Now it's my honor to introduce today's guest speaker, Professor Dr. Ajayan Sadanandan sir. Believe me, I have elaborated CV and biodata of sir. I'm just summarizing it due to the constraint of time. Dr. Ajay Sadanandan sir, an eminent scholar, physician, teacher of Ayurveda. He is currently serving as a professor and head of Department of Dravya Guna Vijnana at Ashtangam Ayurved Vidyapitam and Chikitsalayam, Kerala. Also holds the position of president at the Center of Indian Medical Heritage, ABP Medicinal Plant Garden, Kajikode, Palaghat, Kerala. Dr. Ajayan holds a PhD in Dravya Guna from NII Jaipur, along with his MD and BMS in Ayurveda, with over 18 years of teaching and clinical experience in different institutes across India. He is deeply rooted in the traditional lineage of Agastya Marma Chikitsa, being born and trained in the family of renowned Marma practitioners under the Gurukula system. He learned directly from the masters such as Brahmashri O. Kesavan Vaidyan Sir and other luminaries, carrying forward this rare and authentic medical heritage. His family has a long legacy of treating spinal and neurological disorders, joint diseases, and sport injuries through the principles of Marma Shastra. Dr. Ajayan has made remarkable contribution as a researcher, teacher, practitioner. He has been a member of CCRAS Ministry of Ayush for the documentation and advancement of Marma Chikitsa, has conducted numerous workshop training programs, CME session across India and abroad, introducing students, doctors and researchers to the depth of Agastya Marma Shastra. He has published many works on this, including an outlook on Agastya Marma Shastra. Several papers on its medicinal plant application are widely recognized. In addition to his clinical and academic achievement to this, he has led and guided several ethnomedico-botanical surveys across India, documenting a traditional knowledge and rare medicinal plants, particularly in western and eastern Ghats of India. Carrying forward his family lineage of Agastya Marma practitioner, he continues to integrate traditional wisdom with the scientific research, making invaluable contribution to Ayurveda education and conservation. I hope I have summarized all his work and contribution as well. I think the audience has now gained that knowledge why he has invited to talk on Marma. Due to time constraint, I ask guest speaker to start the lecture. One instruction for the audiences: if you have any queries or questions related to the session, please type it in the chat box. If time permits, we will take the important questions to the guest speaker. Over to Dr. Ajayan sir. I invite today's guest speaker, Dr. Ajayan sir, to start the session.
So today in this ATACON 2025, Marma and Joint Health, unveiling the advanced theories for optimal wellness we are going to see. So thanking the respected chair, Dr. Nidhi Srivastav madam, co-chair, Dr. Sanjay Dalvi sir, Dr. Anil Chandrakant Deshpande sir, and the coordinators, Dr. Munal and Dr. Narendra. Respected dear doctors and friends, so we know that joint health is one of the important things that is very essential for public health. Especially the joint disorders will producing a lot of problems to the human beings to keep away them from various activities. So it is very much necessary that we have to look into the wellness of the joints. So there are numerous informations are available in our classics regarding the wellness of our joints. In spite of that, some of the informations that are available in the Agastya Marma Shastra, we are going to see today. So we can start the section. Om Guruve Namaha. Om Satguruve Namaha. Om Agasthyaya Namaha. Om प्रपञ्चशक्त्याय नमः. Dears, with the blessings of my grandfather and guru, Dr. Keshavan Nadar Swami, and my gurus Karnagaran Vaidya and Sri Raghavan Vaidya, I am able to know about some of the aspect of this Agastya Marma Shastra. So whatever the things that going to see is most of the references are from this Agastya Marma Shastra. So this is a science which propounded by the Lord Shiva and hand over to the Parvati Devi, and Parvati Devi teach this to Subramanya, and Subramanya given this science to Agastya Muni. Agastya Muni made this science in such a form that nowadays we can available lot of sthanas. At least 25 sthanas are in the published form, which will detailedly discussing about the various marma points, what are the problems that will creating various disorders, how we can treat and diagnose these things. So Marma Sutram, Marma Nidanam, Marma Turavu, like that our Charaka Samhita and Sushro Samhita, like that various sthanas are there. So the information today we are going to see is from these aspects. So before starting to this, we can see that presently how the modern anatomist and physiologist are looking on the health of a good joint. So we all know that the joint, especially the large joints of the synovial joints, are not having a direct blood supply. So these blood supplies are by a complicated network of small capillaries. This is called as periarticular plexus or capillaries. So we can see that in these two halves, one half there will be a well developed arteries and these branches will be there, and without any disturbances it is supplying the blood to these epiphysis areas. But once a disease is occurring, there are some other osteophytes or subchondral cyst or some vascular derangements or entanglements are taking place, and it will lead to a degrees of circulation to this particular part and leading to a degenerative changes. So the scientists are believing that these nutrient exchange to this particular epiphysic part and the synovial fluid is taking place especially through the synovial fluid. Because inside the joint, 90% of this joint fluid is about a hydrous matter. It's a watery jelly matter. So the exchange of the nutrients is taking place through a diffusion into the cartilage. How it is taking place? When the inside pressure of the joint and the external pressure that's outside the synovial cavity, pressure is in an unique form without any disturbances, then the exchange will be taking place. If there will be a pressure difference will be more and there will be a compression or a more obstruction to this particular part, then these diffusions will be hampered and slowly the joint will not get the proper nourishment. This will start the degenerative processes. These are the one of the recent findings they are telling about that. So they are going to a conclusion that there will be a particular type of micronutrient supply to these particular part with a particular pressure variations. So the most of the studies are showing that diverse vascular subtypes and a specialized vascular microenvironment within the bone decides the health of the bone. So along with this microvascular blood supply, the synovial lymphatic systems also plays a crucial role in maintaining the joint hemostasis. So there will be a difference in the circulation of this lymphatic system or the blood circulations of the capillaries, then it will lead to various problems. So both these lymphatic drainages and the arterial supplies are contributed and simultaneously associatedly will produce a very good function when there will be a proper pressure balance will be there that will be within the joint inside and the outside. So this shows that how much important is there to preserve a particular environment for the growth of this particular. So with this basis, we can see that how our Ayurveda is looking into this. especially the Agastya Marma Shastra.
झालं sir.
So this Samprapti, Agastya Marma Shastra, Acharya is telling that how a disturbance of this joint degeneration is taking place. Acharya telling that when the Marma is affected, then what the first thing will happen means towards that particular point, the blood circulation will less. The obstruction of the blood circulation will be there. So when the joint is not getting the proper blood circulation, then a heat will generate. So first there will be a disturbances in the blood circulation, then a heat will generate. What the heat will produce? The heat will suddenly will produce a particular type of spasm. So this spasm will lead to again Vayu aggravation. So this increasing of the Vayu will lead to more secretions of rasa, means inflammations. So this inflammatory process along with Vada will become more, then it will lead to a problem of kapha. So first stage there will be a disturbance in the circulation, then there will be a heat generation that will produce a spasm, and that spasm will lead to a Vayu aggravation, and Vayu continuously will produce the secretions, and that secretions along with the kapha will produce a semi-solid mass-like thing. And this semi-solid mass will compress the surrounding srodhasas and lead to various types of symptoms. If it is not treated in the proper time, then it will lead to the aggravation of the disease to other dhadus also. So we can see this in a cymatic way. That's Rakta will be disturbed, Vada is aggravated, then the near Vada will again aggravated, led to swellings, and these swellings will become hard and disturb the Dashavayu. And then if it is not treated in this stage, then it will enter into different dhadus, resulted in various symptoms. So here we can see that the Samprapti will be in the three stages. First stage there will be a Rakta Sangha, a Rakta Vasrodho Sangha and Vada aggravation. And the second, there will be an increasing swelling and Vada. So there will be a Kapha Vada symptoms will be there. Then it is entering into the other dhadus like Majja, Asti, like that. And it will producing various types of symptoms and degenerations. How we can experience this means, in the first stages, what it will be like a tender coconut pulp. It's very soft. But when the tender coconut will become little bit mature, how it will become hard. When it is become a coconut, it will become too hard. Like that, the sankas, the swellings that is occurring on this particular part will compress the important marma points and will disturb the surrounding things. So that the essential nutrients that are needed for the particular joint areas will lose it and lead to a degenerative changes. So why these swellings are lodging in the marma? Because marmas are the point where there will be an anatomically vulnerable susceptibility that all these swellings will drag out there and stay on that particular part. So some of the marma points that will resulting in the back and the below we can see. One of the important marma point is called as Irippu marma, that is on the L5S1. So when some patient is telling that he is unable to sit because of the back pain, and then you palpate this L5S1, you can see that there will be a mild mass and a temperature and a tenderness. And from the middle of that point, the forefinger on the sideways, we can see that the dimples. On that, there will be called as Villu marma. So most of the persons who are having lumbar related problems, if you palpate these points, you can see that there will be a hard, small mass like swelling will be there. Depending upon the nature of these swellings, it will produce more symptoms. So if these swellings are more compressing this particular part, this will produce an indirect pressure on the surroundings of the disc, and the disc will start to degenerate because of the lack of nutritional supply. Likewise, some other points like Sanni marmam, that is on the popliteal fossa. So once there will be a swelling is lodging on this villu marmam or the dimples area, then it is not taken care, it will lodge on this part, that the popliteal area, especially on the medial aspects of the popliteal fossa. So we can see that the osteoarthritic patients, when you palpate it, you can feel this particular area as having a mild swelling. Then if it is not treated, then it will come to the lower part that is called as Nadai Marmam, Achilles tendon insertion area. So nowadays we can see that most of the persons will complaining that in the morning when they are getting from the bed, when they are walking, they have a calcaneal pain. Why this calcaneal pain is occur? Because there will be a sangha is occurring in these particular points, especially on this dimples area and this popliteal fossa, and that will lead to a spasm of these calf muscles, and this tendon will be inflamed and it will lead to this point. So when we are looking into the joint health, we have to look into the above Marma points and below Marma points, because all these are connected through the pranas and the nadis inside. Likewise, when you see the concentration of the Marma points in the knee joint, because nowadays we can see that knee joint health is one of the important part, because early degeneration is seen even in 30s and 40s. So these points like above the patella, there will be two Marma points. It's called as Chiretta Marma. And the below patella, there will be 2 points is called as Naitala Marma. So these 4 points, if you palpate, you can feel a mild swellings and masses, even temperature difference also. And in this medial aspects also, you can see a Muttu Marma, where the exact meniscus we can see. So some of the patient will have the middle of the thigh, there will be a swelling. So these types of swellings will lead into spasms, and that will produce disturbances of the microcirculation of these particular joints, and that will lead to various degenerative changes and arthritic like conditions. So here how we can do a protocol. So the first thing we have to keep in mind is Deepana Pajana has to be done, so that internal and externally we have to give Deepana Pajana with a particular snehas to remove the sangas. So Trigadu, Panjagula, like drugs that will be embedded in thailas like Eranda thaila or Narikela thaila or Tila thaila like thailas, combination of 3 thailas, so that it can produce a Deepana Pajana and can loosen these structures and can remove some of the sangha through an anulomanam, a mrudu anulomanam like that. So it will take at least 14 days to make this sanghas to remove by the medicines. Then we have to go for the anatomical and physiological corrections, because once if the structure is clear and it will become loose, it is easy to keep these structures in the proper positions. So for that purpose, we will use bandages, fichus, labas, and especially Dashamula like combinations. So this is the second place of the treatment protocol. Then the third phase, after these corrections, we have to go for the Sandhaniya and strengthening exercise. So here we have to look into Laksha, Panjakshiri, Lagu Panjamulam, especially Lagu Panjamulam, Bela, Madhyama Panjamula like drugs. So like that, if we plan a 42 days of treatment with first 14 days with a Deepana Bhajanam Sneharam, then massages and bandages with anatomical and physiological correction for at least 21 days. Then after that, we have to advise a small moments of exercise and with Rasayana Sandhaniya Aushadas. So then we can regain these degeneration with a regeneration. So with that background, we have to look into some important combination that is mentioned in Agastya Marma Shastra by Agastya Muni. So Deepana Pajana, we need a lot of good Ushna Virya Dravya that can penetrate into the deep Majja Asti. So most of the time Panjagola or this Trigadu can't able to reach to that level. So Acharya put a 6 Tandula, Shat Tandula. In Tamil and Malayalam it is called as Ariyar. So these 6 Ela, Vidanga, Indreva, Vakuchi, Dhanyaka, Jyotishmadi combination in a yoga will help to penetrate and remove the sanghas of the Majja and Astidhatu. And it is having a very good action on the cost also. So this 6 grains as having a very important role in managing the circulation correction of the joints. Even we can prepare the soups with this Shattandula and can be used for Deepana Pajana purposes. Another important drug is an unavoidable drug is the Laksha. So in the second stages of the treatment protocol, we need the incorporation of Laksha in the treatment so that it can act as a Sandhaniyam and can build up the structures of the ligament, Sira, Snayu, Sandhi, and Kandaras. So all these Ubalebas and its strengthening needs this drug. So this is also one of the important drug of choice in the Asti Sandhis. Then in some of the deep-seated diseases, especially the Majja Dhatu, is osteochondritis or meniscus become very much thin, then dried. Then some of the types where there will be a disc is too much degenerated, we need some Jangama Aushadas also. So one of the important Jangama Dravyas that used for the regeneration of the Majja is this Aja. So the gods Vasa, the gods Mamsa, the gods Majja is used by Agastya Muni for correction of this. So a 21 days of giving, this pill helps in the final stages of the strengthening of this. So even in our classics it is mentioned Param Balagaram Richam Brahmanam Viryavardhanam. So the Asti and Majja and Vasa of this animal is very much suitable to our body. So Majja Sirda, Marma Bikhadas and degeneration, we need such type of a combination. So along with this, one of the important is the Marma massage, because these medicines are unable to do the high level activity inside the body. So we have to assist the body with some external simulations. So wherever you are feeling that such type of a small nodes will be there and it will producing a compression, to remove this compression of the Sangha, we have to help the body from outside also. Because already we have discussed that. Once the swelling will become a soft, like a tender coconut, by giving the medicine, then we will go for the massages. The massages should be in the round, especially giving a round massage in the popliteal fossa will helps to reduce the swellings, at the same time increase the circulations to that particular part. So this mild heating is the ideal heat for a joint. So Hasta Sweda is the important Sweda that we have to give to the joints. Because Siras Snayus are the very delicate structure. If we go for a big Swedas, it can rise up and the Snigdhata will lose. So if you give the Hasta Sweda, means it will be very helpful for that. So these Marma points, we have to stimulate it with round massages that can increase the circulations and reduce the swellings. So then another thing we can use is the Kattumurai, the bandages, giving the pitchus to these particular points. These Marma points, if you observe, we can see that there will be a particular type of heat exchange will be there. So we have to use a pads like this. It will help to retain the oil, and with a cloth, we can soak it and keep on that particular Marma points. So by keeping this for a continuous, you can see that it can reduce the pain, swelling, healing, and the retainment of the medicaments will be there. And it will help in the supporting of these structures also. So a recent finding you can see is here, it's a thermal imaging technique. Nowadays, we can use the thermal imaging technique to know about the inflammation, how it will be there, and where the inflammation is concentrated. So this thermal imaging photo is showing that the popliteal fossa has having a middle of that Marma point is having the most inflammatory point. On that point, keeping these pitchus and doing the bandages and keeping at least for 8 hours will help to create an external environment. So this external environment will create a force to that particular area so that the body has to be respond. So by that, using these techniques of simply keeping the oils or medicaments on that particular area for 6 hours at least will helps to regain the strength of that particular structure, same time to remove the swellings and in a better way. So that's why using the technique of body response by creating an external environment to do activity on the internal environment is one of the important way in Ayurveda and Marma Shastra. So this way of using internal medication along with massages and along with these types of bandages will help a lot in the bringing up of the joints to a normal level. Even in the meniscal injuries, even in the ligamental injuries, tendon injuries, and arthritis-like conditions, we can adopt these types of techniques. So here, what I like to share is there will be a very much important of the interaction process is going on. A physiological action is normally taking place the internal joint environment, and there will be an external joint environment. So correcting these balance of the internal and external joint environment is an essential part of the treatment. The aim of these types of treatment is making these both areas in a proper way and balancing the pressure of this and helping in the correction of the things. So this is all about the small presentation. So thanking once again for Ayurveda Teachers Association for giving an opportunity to share these informations. So there are so many great Vaidyas and persons are there. Something want to discuss, we can discuss. Thank you one and all. Om Guru Namaha.
Thank you so much, sir. This is really elaborated presentation with images and all the information. I think one of a kind information for Marma and joint health. Now I would like to invite the chairperson of the session, Dr. Nidhi Srivastava Madam, for her keynotes and some remarks on the session. Over to Dr. Nidhi Madam, please.
हेलो, हाँ, आप सब लोगों को मेरा नमस्कार। सबसे पहले तो मैं आप लोग को सुनाई दे रहा है?
Yes, madam. Yes.
जी। सबसे पहले तो मैं एटाकॉन के आयोजकों को धन्यवाद देती हूँ कि उनका जो मॉर्निंग
Yes, ma'am. Yes.
हाँ, मॉर्निंग से सारे सेशन बहुत ही अच्छे चल रहे हैं और मैंने सभी अटेंड किए हैं और काफी मतलब बिना किसी व्यवधान के चल रहे हैं, तो ये बहुत अच्छी बात है, नहीं तो व्यवधान आते हैं। तो अभी डॉक्टर सदानंद जी को मैंने सुना, तो मर्म, चूंकि मैं एनाटोमिस्ट हूँ, NIA से ही मैंने MD PhD किया है, तो मेरा मर्म पे ही मेरा MD थीसिस था और मर्म पे ही मेरा PhD थीसिस था। तो मर्म में मेरा इंटरेस्ट का क्षेत्र वैसे भी है, लेकिन ये अगस्त्य मर्म शास्त्र जो बताया डॉक्टर साहब ने, मैंने काफी उसको सुना था, पर आज उसके बारे में ज्यादा जान पाए कि किस तरीके से उसको एक्सटर्नल इंटरनल करेक्शन करके उसको यूज करना चाहिए, किस तरीके से दीपन पाचन औषधियों का भी यूज होता है, पिचू धारण, और काफी अच्छा उन्होंने बताया है कि लेक्चर थोड़ा शॉर्ट था, लेक्चर थोड़ा सा और बड़ा होता तो मुझे लगता कि वो और अच्छा रहता कि हम ज्यादा इसके बारे में और जान पाते, पर ठीक है, होते रहते हैं सेमिनार, आगे फिर कभी सुना जाएगा। और बहुत अच्छा इनका सेशन था, लेकिन शॉर्ट एंड स्वीट जिसे हम कहते हैं, और बहुत ही नॉलेजेबल था। तो मैं आयोजकों को और सदानंद जी को बहुत बहुत धन्यवाद देती हूँ इस सेशन के लिए और इस अपने उद्बोधन के लिए। धन्यवाद।
Now, namaste everyone. Now I would like to invite co-chairperson Dr. Anil Deshpande sir for his valuable remark on Ajayan sir's lectures. Sir, please over to you.
Good afternoon, one and all. Very nice deliberation regarding Marma Chikitsa and joint health, as he is working in Agastya Marma Chikitsa. So I would like to comment that it is a very good lecture, basically with a very good person having a very ancient legacy, Dr. Ajayan sir. So I have met once him, and he is a very nice and enthusiastic person as far as Marma remedies are concerned. So he has pinpointed goat milk, that is chaga mausa, for the majja and asti nourishment to soothe vayu. It's a very nice thing. I would like to add one or two combinations. This is Vatari Dravak is there in we can use having Aja Mausam. Then there is a one beautiful combination we can use as far as the Marma Chikitsa and joint health is concerned. That is Mustadi Marma Kashayam is there. Having Brangaraj, Haritaki, then Musta and Dashamul combination. It's a very beautiful combination and which is very useful in such a conditions. And just I want to comment that there is one combination which is not frequently used. The one oil is there from Sahasra Yoga, that is Ketaki Muladi Thailam is there. So it is directly quoted that it pacifies Astigatavat. So Ketaki Muladi Thailam is there. So it is a very good area and good opportunity for the postgraduate students to have research on this as far as joint health and Marma is concerned. So I would like to know from Ajayan sir regarding whether he used Ketaki Muladi Thailam in his regular practice. Overall, the lecture was very informative and very nice. So thank you, thank you, and thank you very much for the opportunity as a co-chairman. And thank you, Nidhi madam and Sanjay Davi sir for accompanying me in this beautiful session. Thank you, one and all.
Thank you, sir. Thank you very much.
Yes, sir. Kedagi Muladi Taila is good, sir, for internal and especially as external also. And some of the Vaidyas are using this for even Vastis. So it will be a very good drug of choice,
Okay, sir.
drug of choice for this Asti under Madjagada Rogas.
Yes, sir. Yes, sir. Yes, sir. Thank you. Thank you, sir. Thank you very much.
Thank you, sir. Thank you.
Sir, one question is there. What's
Yes,
the
ma'am.
difference between Sushruta Marma and Agastya Marma? If you can.
Madam, difference is actually as per the concept and all these things, it's similar, but the approach is a little bit different. Why means this Agastya Marma Shastra is looking on all these aspects of injuries that has happened due to some fight or fall injuries and this. And after that, Ajayan is looking the symptoms, what are the clinical presentation of a Marma Vikada and how you can diagnose these Marma Vikadas in a different way. Then after this diagnosis, you are looking into the medicines for a particular Marma because all the Marmas are not a unique one. Each Marma has having a particular predominance of doshas. So depending upon the predominance of doshas, how you can manage this and manipulate the anatomical structures that are deformed from a particular place, correct it to that particular level, and then how you can pacify the karmatmaka, what it is taking place inside. So both the ways the prana should be maintained properly. So for these purposes, they adopted various techniques like massages, stimulations, along with bandages and drug applications. So Sushrutacharya looked these marmas in another aspect. Acharya looked, these are the one of the important points we should be taken care when we are doing a chedana or lekhana or something punchering or like that things. Because these surface points, if you done on this particular area, especially Agni Karmam like things, if you particularly doing on this particular Marma point may cause injuries. To avoid that, Acharya is more stressed on that aspects and told about these Marmas and this. Here, it is more related to the therapeutic management of the points. That is the one of the important thing we can see in this Marma, Agastya Marma Shastra.
Very well, sir. Okay. Just one more question we are taking due to time constraint. Dr. Aditya Lavdikar has asked, does this Shatatandula and Ketaki Mulani Taila can be used to relieve the bone pain and are they fast acting?
Yes, of course. The bone pain usually if it is you are feeling that it is having a correct kapha vada predominance or vada kapha predominance, surely you can go with this Shatatandula because that is one of the best combination that you can utilize with that. So the Dashamula combination with Shatatandula can be a good drug of choice in kapha vada predominant conditions. And you are expecting that it has reached this vitiation of the doshas are reached up to Asti Madhya. We have to use this type of things. Surely it can be a useful thing. And if you are feeling that there will be a severe degeneration is there, that there will be a in-depth problem, structural problems in the Majjadadu and Astidadu, along with a Dadu Gadatwa Pitta association is there. A Dadu Gadatwa Pitta association also. So the patient will show all the Kaphavada symptoms along with a little bit of Pittaja symptoms like a burning sensation or a particular type of Rama like feelings. Then we can think that it is Pitta Anubandha also. On that, Kedaki Muladi is one of the very good drug of choice. That's why in some of the deep-seated diseases like avascular necrosis or any osteophytic more changes that occurring in the disc, we can go with this Kedaki Muladi Thailam like that. So that's depending upon the choice of the Vaidya, because we have so many combinations in our Ayurveda also. Depending upon the need, you can select that combinations also.
Sure, sir. I think this elaboration and explanation has very well answered to this question. Moving forward, I would like to give vote of thanks. So on behalf of organizing team of the fourth session of the webinar series on future avenues and recent advances in Ayurveda ATACON 2025, it's my privilege to deliver the vote of thanks. First and foremost, I extend our heartfelt gratitude to our esteemed guest speaker for sharing his valuable knowledge and deep insights on Marma and the joint health. Your enlightening talk has enriched our understanding and inspired us to look at the Ayurveda and this Marma Chikitsa in newer dimensions, sir. I also sincerely